Most people who are diagnosed with colon cancer say the same thing afterward. I noticed something. I just thought it would go away. Here's what makes colon cancer different from many other diseases. It rarely arrives loudly. It builds slowly, quietly, through signals that are easy to explain away. A shift in digestion, unusual tiredness, a discomfort that comes and goes. Today, we're going to walk through 9 of those signals, not to alarm you, but because knowing what to look for is one of the most powerful things you can do for your long-term health. Your colon, about 5 feet of large intestine, does quiet, essential work every day. It manages water absorption, processes waste, and keeps your digestive system in balance. When that balance shifts, your body responds. And that response is what we call a symptom. A critical point before we begin. Every sign we discuss today has multiple possible causes, most of them benign. What matters is persistence. Symptoms that are new, worsening, or lasting more than 2 to 3 weeks are the ones that deserve a conversation with your doctor. Let's start with the one most people get wrong. Sign number 1, blood in the stool. This is the sign most likely to be dismissed, and one of the most important not to. Blood in the stool comes in 2 forms. The first is visible, red or dark maroon streaks in the toilet bowl or on tissue. The second is invisible, what clinicians call occult blood. It can't be seen, but it shows up on a simple screening test called a FIT test, or fecal immunochemical test. Most people, when they notice blood, assume hemorrhoids, and often they're right. But here's what matters. The appearance of blood from hemorrhoids and the appearance of blood from a colon polyp or tumor can look identical. That's not a reason to panic. It's a reason not to self-diagnose. Any new or unexplained blood, visible or suspected, is worth one conversation with your doctor. That's it. One conversation. Sign number 2 is distinct from the first, and the difference matters. Rectal bleeding refers to blood you can see during or after a bowel movement, on tissue, in the water, or as a streak. Sign 1 was about blood mixed into stool or hidden entirely. This is blood that appears externally during elimination. Bright red blood most often points to a source near the end of the digestive tract. Hemorrhoids, fissures. Darker blood, or blood that seems mixed into the stool itself, may originate higher in the colon. The important thing isn't trying to identify the source yourself. The important thing is that bleeding from a rectal tumor and bleeding from hemorrhoids can be indistinguishable to the naked eye. New rectal bleeding, especially if it recurs or if it's accompanied by any other sign in this video, warrants evaluation, not anxiety. Evaluation. Sign 3, unintentional weight loss. Losing weight without changing anything, no new diet, no increase in exercise, is something doctors take seriously. When a tumor is present in the colon, it can interfere with nutrient absorption. The body's immune response can raise baseline energy expenditure. Appetite suppression may quietly compound the effect. The clinical benchmark worth knowing. Losing more than 5% of your body weight over 6 to 12 months without explanation is considered medically significant. 5%. For a 160-pound person, that's 8 pounds. An amount easy to attribute to stress or a busy season, until it isn't. If weight is coming off without a reason, that's your body asking a question that deserves an answer. Sign 4 is one that hides in plain sight. Persistent, unexplained fatigue. Not the tiredness of a hard week. Not the kind that a good night of sleep fixes. This is the fatigue that settles in and stays. disproportionate to what your life actually demands. Here's the mechanism behind it. When a tumor bleeds slowly over time, too slowly to see, the ongoing blood loss depletes iron stores. The body develops what's called iron deficiency anemia. And anemia, at its core, means your blood is carrying less oxygen to your tissues. The result isn't just tiredness. It can be weakness, breathlessness with mild effort, a kind of mental fog, or a persistent pallor. A simple blood panel can detect anemia in minutes. If fatigue has become your baseline, that blood test may tell you more than you expect. Sign 5. A meaningful, persistent change in your bowel habits. Your digestive system has a rhythm. Your body knows what's normal for you, and so do you. Which is exactly why any significant departure from that baseline deserves attention. This includes changes in frequency, going more or less often than usual. Changes in consistency. Stool that is consistently looser, harder, or noticeably different in shape. A feeling of incomplete emptying after a bowel movement. Short-term changes happen to everyone. Travel, stress, a change in diet, these all shift the pattern temporarily. But a change that persists across 3 or 4 weeks without an obvious cause is a different conversation. A tumor growing inside the colon exerts physical pressure on that passage, and the first sign of that pressure is often a change in the pattern you've had your whole life. Sign 6 is constipation, but not the ordinary kind. Everyday constipation has obvious explanations: low fiber intake, dehydration, sedentary days, certain medications. It responds to simple changes. It resolves. The constipation worth noting is the kind that is new, persistent, and resistant. The kind that doesn't respond to what would normally work. A tumor developing inside the colon gradually narrows the channel stool travels through. That narrowing doesn't announce itself. It shows up, slowly, as constipation that progressively worsens, and that may be accompanied by cramping, pressure, or a sense of blockage that feels different from anything before. Adults over 45 and anyone with a family history of colorectal cancer should pay particular attention to unexplained new-onset constipation. Context and persistence are everything. Sign 7 sits on the opposite end: persistent, unexplained diarrhea. Most diarrhea resolves within a few days. A passing infection, a food reaction, a medication adjustment. That's not what we're describing here. In some cases of colorectal cancer, a tumor creates a partial obstruction. Liquid stool can pass around that blockage when solid stool cannot, producing frequent, loose movements without an obvious cause. In other cases, tumor-related inflammation disrupts the colon's ability to absorb water normally. Diarrhea that persists for 2 weeks or more without a clear explanation, or that alternates with unexplained constipation, is a pattern that warrants a physician's attention. Sign 8 is one many people live with for months before mentioning it: persistent abdominal discomfort. Not the bloating after a heavy meal, not the cramping of a stomach bug. This is the discomfort that becomes a background feature of daily life: a dull pressure, recurring cramping, a vague fullness that doesn't quite resolve. Some people describe it as a feeling that something is simply off, not painful, not dramatic, just consistently present in a way it wasn't before. When a tumor is present in the colon, it can interfere with the movement of gas and stool, cause localized inflammation, and create a low-level pressure that the body registers as discomfort or fullness. If your abdomen has been sending you a signal you keep dismissing, it may be time to stop dismissing it. Sign 9 is quiet and easy to rationalize away. You sit down for a meal you would normally finish, and find you don't want it after a few bites. Your appetite has shifted in a way that feels different from stress or a busy week. Food simply doesn't appeal the way it used to, or a small amount fills you in a way it never did before. Clinically, this is called early satiety, and in the context of a gastrointestinal warning, it matters. A mass or obstruction within the digestive tract can create physical pressure that mimics the sensation of fullness. Beyond that, the body's systemic response to certain internal conditions can suppress appetite through mechanisms that aren't yet fully mapped, but are well documented. When this is new, persistent, and happening alongside any other sign we've covered today, it belongs on the list you bring to your doctor. 9 signs. And it's worth saying this plainly. Most people who experience one of these symptoms do not have colon cancer. The human digestive system is sensitive. It responds to hundreds of variables: diet, stress, sleep, medication, minor infections. Most of the time, what you're feeling has a benign explanation. But here's the reality of early detection. Colorectal cancer, when found early, has a 5-year survival rate above 90%. When found late, that number drops significantly. The difference between those two outcomes is often just one appointment, made early enough, persistent, unexplained, new. Those are the 3 words to hold on to. If what you're experiencing fits even one of those, you have every reason to make that call. Not because something is definitely wrong, because finding out, before it becomes urgent, is the most informed decision you can make. If anything in this video connected with something you've been noticing, please don't wait. Schedule that appointment. Bring your list of symptoms, how long they've been present, and whether anything makes them better or worse. That conversation takes 20 minutes. It can change everything. If this was useful to you, subscribe to Novalix Health. We produce evidence-based health education for adults who take their well-being seriously, without the noise. And if someone in your life is overdue for a colorectal screening, share this video with them. Sometimes the most important thing we can do for the people we care about is hand them the right information at the right time. Take care of yourself. We'll see you in the next one.